Last week, the Hemet Fire Department confirms that they got called out to the hospital not once, but 3 separate times. They say on one visit, firefighters did smell something that smelled like raw sewage, but didn't find anything else alarming. And the hospital insists the facility is safe, but some workers say otherwise.
What is it going to take for you to care about your staff's safety?
In the last week, Jessica Meinert says tending to the sick at Hemet Global Medical Center has made her sick. And the ER tech and union shop steward says she's not alone.
With dizziness and headaches and fog and all that stuff that's still going on today. I am one of the patients that did check in. So it is happening. It is real.
Last week, workers at the hospital, which is owned by KPC Health, started complaining of a mysterious odor and say it got so bad the hospital had to clear out the ICU on the 5th floor. The fire department confirms they were called out to the hospital 3 times, but can only test for certain gases or hazardous materials, which all came back negative. But now the Service Employees International Union, which represents about 500 workers at KPC Health, is calling for more testing.
Early this morning, I was actually talking to OSHA in Riverside, and that they are going to investigate.
An employee says this memo was handed out at the hospital warning about a sewer gas leak in the ICU that could cause symptoms including nausea and dizziness. When we asked, the hospital did not address the memo, but did acknowledge that some parts of the building were temporarily closed for plumbing repairs, and said in a statement, Hemet Global Medical Center remains safe and fully operational.
We are in contact with the employer to try to get to the truth of it.
Last year, the hospital had more than 5 times the state average of complaints, according to the California Department of Public Health's database. The complaints included not having enough nurses in some units and the need for more standards and training.
There is no reason why I should come to work and have a headache where my migraine medication is not working.
Meinert says she is one of several people who felt so ill that they sought out medical attention. The union says they're still trying to determine how many people are complaining of symptoms and what was done or is being done to address it. Live in Hemet, Chrissy Fajardo, Fox 11 News.